Emphysema is another disease process. It's considered an obstructive lung disease because when patients have emphysema, the alveoli are damaged. The alveoli are the part of the respiratory system that help with gas exchange. So when the alveoli are damaged, gas cannot be exchanged in and out of the body. Oxygen can't get into the blood, and carbon dioxide cannot be exhaled efficiently. One of the most common causes of emphysema is cigarette smoking. The other risk factors would be long-term exposure to like toxic fumes or air pollutants or dust. There could also be a genetic deficiency that causes emphysema, and that is the deficiency of alpha 1 antitrypsin. Some of the symptoms for emphysema are shortness of breath, a chronic cough with minimal sputum production. Sputum is not the issue here. They would also wheeze when they're breathing in and out. They may do pursed lip breathing just because they're having to create back pressure to keep the alveoli open. They would also have a barrel chest, and that's due to the hyperinflation that they have. That's in like the more later stages of emphysema, but air trapping is a thing since I said that the air cannot be moved in and out of the body efficiently. When we do chest x-rays on patients who have emphysema, some of the things that we see are hyperinflation, and this is just the air trapping showing. This is also going to push the lungs down, so it's going to cause a flattened diaphragm. And then we see some decreased markings on the lungs, and this is just because of the alveolar deconstruction that emphysema causes. The ABG results are different depending on the stage that the patient's in with their emphysema. If it's early stage emphysema, it might just show mild hypoxemia, normal or low CO2. If the patient's in a later stage of emphysema, we would see chronic respiratory acidosis, high CO2, low pH, and this is due to the air trapping in their lungs. If the patient's in a more severe stage of emphysema, this is where we're going to see a compensated respiratory acidosis. The bicarb is starting to rise in order to balance the pH. We do diagnostic tests to be able to confirm that someone has emphysema. We do PFTs. When we do pulmonary function tests, we're going to check for increased residual volume and decreased FEV1 FVC ratio. We also do CT scans to check for bully, and bully is just air pockets in the lungs. They would also do the genetic testing for the alpha 1 antitrypsin to see if they can rule out any genetic causes of emphysema. When we're putting oxygen on a patient who has emphysema, we have to be careful because they're relying on their hypoxic drive to breathe. So if you deliver too high or too much FiO2 to a patient, you're going to knock out their hypoxic drive. If you do that, they're going to stop breathing. So use a very low flow if you're going to put them on a nasal cannula, like 1 to 2 liters. Anything that helps you keep the O2 sat between 88 and 92% is just fine. If they're having an exacerbation and the work of breathing is super increased, put them on a BiPAP. If they're in their most severe stage or most advanced stage of emphysema, they may need to go on a ventilator. When we're giving medications to patients who have emphysema, we're going to focus on a couple things. The first thing that we're going to address is the bronchoconstriction. So we give a bronchodilator. We can give a short-acting bronchodilator like albuterol, or we can give a long-acting bronchodilator like Spiriva. Then we're going to focus on the inflammation that the patient may be experiencing. If they need a corticosteroid, we would give them fluticasone, and that medication is going to help reduce the inflammation in the airway. We would also give mucolytics because of the increased amount of secretions that they may be experiencing. That's just going to help loosen them up and help them cough it up. We would use antibiotics too, and that's if the patient's having any sort of infection due to the fact that they're in exacerbation of emphysema. That's everything you need to know about emphysema.